Thank you very much, Dr. Mahipal. I would invite Dr. Sanjay Chaudhary now to talk why his preferred technique is Lasik and why not smile. We'll have a discussion later on. Thank you.
Thank you. You've seen the bright side of smile. I think it's time the audience saw the dark side of smile. And I am here to reaffirm your faith and confidence in the good old standard technique, which is the Lasik. Okay, now let's look at this situation. What happens when a small thin edge of the lenticule breaks and gets left behind within the eye? Something like this. Is this working? So this is the lenticule. It has broken into the eye, and here you have a cornea which is slightly elevated. And this elevated island of the cornea is going to give you irregular astigmatism and a large coma, almost impossible to correct with glasses, almost impossible to correct with topo-guided Lasik treatment. So what do you do with this? What you try to do is, which is being done in smile cases, is that if the edge of the cornea is too thin here, then you want to make it thicker so that it doesn't break within the eye. And how do you make it thick? You start leaving a table of corneal tissue under this lenticular area, which means if this is the lenticular area which we are talking about, so okay, so if this is the lenticule which you are supposed to remove, now you have to make this edge which is about 1 micron, 2 micron thin. You have to make it thicker so that it doesn't break. Now how do you make it thicker? You add this table of tissue to this lenticule. So you add about 25 microns of this table all along the lenticule. So you make it thick enough so that you can take it out so that it doesn't break. Now what is the effect of this? We know that 12 microns of corneal tissue is used to correct 1 diopter of correction. Then what happens when you are adding a table of 25 microns? You are wasting, I repeat the word, wasting 25 microns of extra tissue just to take out the lenticule. So for example, if you are doing a Lasik of 1 diopter, you have to do a smile which is going to remove tissue of 3 diopters to get a 1 diopter of correction. Where is the logic? And just look at this situation. If you have to do a Lasik which corrects 8 diopters in smile, you have to remove 10 diopters of tissue to correct 8 diopters. So there is extra weakening of the cornea for the same effect. Again, who wants to buy this? So what is the paradox here? The paradox is that when we were doing a blade surgery and we went to the femto bladeless, we said SBK lifts up a flap of 110 microns and the femto lifts up a flap of 90 microns. We are saving 20 microns. Wow, that is why we are going femto bladeless. And now from femto Lasik to femto smile, you are wasting 25 microns. Where is the logic? Okay. Now what about the accuracy of correction? Of course, you'll see there's a bias in studies, and there'll be a lot of studies which my worthy colleague has already mentioned that there's a high accuracy of correction in smile. But the real picture is now emerging, and these are the studies. 74% of the people were within plus minus half of the attempted correction. This is in the Journal of Cataract and Refractive Surgery, which has come out this year. That means 25% of the people are outside this range, which means 1 in 4 are outside the limit of the plus minus 0.5, and these guys will need enhancement. 1 in every 4, can you imagine? In Lasik, 1 in every 4 patients, you have to tell them, okay, I'll have to do a retreatment. It's impossible to even imagine this situation. And even if you have to do a retreatment, how do you do it? In Lasik, it is simple. Just lift off the flap and do it. But how do you do it with a smile? You can't. You just can't cut another lenticule in the same area. It's just not possible. So what is possible in smile? So you can do a PRK over that area. And it has been conclusively shown that if you do a PRK in this situation, there is a high incidence of corneal haze. And this was highlighted at this ECRS symposium by Michael North, that even if you have to do one diopter of correction, you have to use mitomycin in this smile-treated eye, whereas the normal corneas, if you remember, if you do PRK up till 4 diopters, you don't have to use mitomycin. And loss of best corrected visual acuity in smile. Okay, the pro lobby is talking about a high degree of accuracy. But there are these papers coming out now which are showing you the real face. And the real face is 12% of the eyes lost one line of corrected distance visual acuity. 12%, which means 1 in every 10 patient loses one line of visual acuity. Is that tolerable? Have you ever heard about that in Lasik? And what about ectasia, which is the main issue which smile is all about? Literature again says no. Of course, a lot of literature says yes, but the no literature is also coming out. Central area weakening is similar in both cases. And here are the reports. This publication says the flap-based Lasik and 3-flap relax smile result in similar reduction in corneal biomechanics. Similar reduction in corneal biomechanics. There is no difference. So this was not one paper. I went to another paper. Here, there were no differences between smile and femto-LASIK treatments in post-operative corneal hysteresis and corneal resistance factor value. There is no difference at all. So it is just a hype. And so what is smile all about? So smile is about a 4 crore equipment which has a poor accuracy of correction, which no smile lenticular enhancements, which can have haze on PRK enhancements, which can have no hyperopia correction, which do not do pure cylinder corrections, which has poor centering as there is no eye tracker, which has no wow effect. In LASIK, you have a wow effect. In smile, it is seen that the next day the vision is not exactly 6.6 in all. It is 6.9 and it recovers in about 2-3 days, which has no reduced risk of ectasia, which is not FDA approved, which weighs 2 diopters of corneal tissue per case. So, this is what smile is all about. Whereas LASIK, accuracy of correction is high. In my last slide, enhancements are easy and safe. Hyperopia is possible. Pure cylinder correction is possible. Tracking and centering is excellent. You have 1000 hertz of tracking. Wow effect within half an hour. Within half an hour, the patient starts saying, yes, I see very well. Ectasia risk is same as in smile. FDA approval has been there for years, and there is no tissue wastage. So, for the audience, I say LASIK is definitely a safer and a better option than smile as of today. Thank you.